You've got cancer. Words nobody wants to hear. Getting a cancer diagnosis is a very scary situation, so it's really important to know all of your treatment options, especially those that have little side effects. Joining us this morning, Dr. John Kressel, Phoenix Cyberknife Center, with how they can help. So good to see you, Dr. Kressel.
Good to see you.
And it always boggles my mind because we've talked a lot about Cyberknife and what it is. When I talk to people who've been diagnosed, I'm like, you got to call Cyberknife, right? So explain to everybody what makes you different and unique and how you help.
Well, Cyberknife, that center we developed as a center of excellence for radiosurgery. And radiosurgery is a part of radiation therapy, which is a mainstay for cancer treatments. But it's more advanced. It's the state of the art now. It's much more precise, very accurate, so we're not treating a lot of surrounding normal healthy tissue. So side effects are less, recovery time is less, and in many instances, we can give more radiation to the tumor, which increases cure rates.
So give me an idea of what a treatment might be like then.
Well, one of the best examples is that standard radiation therapy for prostate cancer can be up to 45 treatments over 9 weeks.
Whoa.
Because we're so precise, we can now deliver that entire treatment in just 5 days. It's all done in a week. And because we're so precise, we're not treating a lot of that surrounding tissue. We can deliver a higher dose more quickly. It's actually a more potent dose radiobiologically. So it's a very good treatment option for patients.
Okay, so I heard the word potent, but I said earlier little side effects. So what does that mean?
So it's potent, meaning it's to the target is more effective.
Okay.
But the surrounding tissues are still spared because this is the only radiation treatment device that actually moves with the patient as a target or as the patient is breathing for like lung cancers. And because of that, you can stay on your target more precisely. You're not treating the surrounding tissue with uncertainty or margins or movement.
That is fascinating. So who is a good candidate for Cyberknife?
Well, Cyberknife has been applied to all kinds of cancer throughout the body, brain, spine, breast, lung, prostate, liver, kidney. So it's very universal with regards to who it's applicable to. So most patients, it is an option for them, but not everybody.
Okay.
And we have that discussion with them. That the other thing is the center that we have also provides all of the other forms of radiation therapy. So they don't have to go anywhere else. Whatever is best for the patient, we can provide.
And is this covered by insurance?
Yes, it is. So it's a standard of care by Medicare and all of the providers for the appropriate treatment.
So anybody listening right now, what is the best way to find out if Cyberknife is for them?
Well, sometimes it's your treating physicians, but
Okay.
not every one of them is educated for Cyberknife or radiosurgery. So, you know, really talking to a physician that's trained in it and does it is your best option. And we're happy to provide, you know, input and resources for patients who are inquiring. And sometimes just second opinions are very helpful.
Absolutely. And on top of that, Dr. Kressel's going to stick around because coming up later, we're going to sit down with one of his patients, a great success story. You will not want to miss it. So, all right, stick around, Dr. Kressel. Let me give you some more information. If you have any questions about Phoenix Cyberknife and Radiation Oncology Center, you can email questions. It goes actually right to Dr. Kressel. It's info@pcroc.com. Here's where they're located, 4611 East Shea Boulevard in Phoenix. That number to call, 602-441-3845. And you have more questions, learn more, visit PhoenixCyberknifeCenter.com.